It's 2 weeks ago since you were last in the studio, sitting in that very chair. I asked you if there was going to be another national lockdown, and I just want to play viewers your response to that question. 2 to 3 weeks circuit breaker to give us some breathing space to get on top of test and trace. People want to know, is that going to happen?
No.
It was a one-word answer, no. Why should people trust what you're going to tell them today?
Well, during the course of the whole of that interview, I outlined that we would be willing to take whatever steps were necessary. But it wasn't necessary at that point. At that point, the advice that we were receiving was that a regional approach could succeed in reducing the spread of infection from those areas where the infection rate was high to those areas where the infection rate was still, relatively speaking, lower. But unfortunately, over the course of the last 2 weeks, the virus has been spreading faster than predicted, and in a way that requires, as you quite rightly pointed out, what the Prime Minister has described as the nuclear option. And we've taken these steps because we believe that it's absolutely vitally necessary to safeguard the NHS at a time when the infection rate is doubling, when the number of people going to hospital is increasing significantly, and when the strain on our health service is such that we do need to take action. It's
a question of trust, though, isn't it? Because, as you say, later on in the interview, you expand on the answer, but when I asked you directly a simple question, is there going to be a second national lockdown, you chose to give a one-word answer. No, there was no nuance on that.
Well, you were asking, of course, about the context at that time. Was there going to be a circuit breaker of the kind that was being proposed
2 weeks ago? It's not that long
ago, is it? At that time. Well, one of the things about the virus is that over the course of the last 2 weeks, we've seen, not just in the United Kingdom, but also in France, Germany, Italy, and other comparable countries, the spread of the virus being greater than any of us had anticipated.
Just 2 weeks ago, we did know, though, didn't we, that cases were rising. SAGE were already recommending a national lockdown. We knew that deaths may go up as well.
Well, we also know that at that time, the advice that we were receiving, including from the Chief Medical Officer and the Deputy Chief Medical Officer, was that a regional approach could work. As the Chief Medical Officer last night said...
Well, that's not what Sir Patrick Vallon said. He said that Tier 3 restrictions weren't going to be enough to bring down the spread.
I think you're confusing two things there. The first is that Sir Patrick and others said that Tier 3 restrictions on their own would not be enough, and that is why we were in negotiation with local authorities, something we were discussing 2 weeks ago, in order to ensure that we had the base Tier 3 restrictions plus additional measures. And those additional measures have been put in place in Liverpool, in South Yorkshire, in Nottinghamshire and elsewhere. But it's also the case, as the Chief Medical Officer pointed out last night, that there's no good time, no perfect time to act at that stage. It was entirely possible that we might have been able, using a regional approach, to balance the need to combat the virus with keeping as much of the economy open as possible. And that's always been our strategy. But just last week, I was talking to my counterpart in the French government. There, they were also pursuing a regional strategy and indeed augmenting it. But again, the spread of the virus there in France compelled the French president earlier this week to acknowledge that a national approach was required. All of us have been faced with data, which means that the original projections about the spread of the virus actually underestimated it. And again, at the time that our scientific and medical advisors were talking about the future spread of the virus, there were a number of people entirely in good faith who questioned that. Well, actually, the situation has been worse than any of us expected, and that is why action is now required.
You're talking there about the situation being worse than anyone had expected. Of course, you were in that meeting on Friday where 4 of you saw the data that clearly was alarming. How bad would things have been this winter?
Well, I won't talk about that meeting specifically, but more broadly, the information which has subsequently been shared, including at the Prime Minister's press conference last night, shows that if we weren't to take any further action, if we were simply to leave things as they are, that we would see hospital capacity during the course of November diminish. We would see across the country, including in areas like the southwest, which hitherto have seen less of the virus than other parts of the country, we would see hospitals filling up. And very quickly, we would have to cancel elective operations. Then we would have to say that some emergency treatments were no longer viable. Then we would have to say that some people who are currently in hospital would have to be discharged. The consequences of that, if we don't act, is that by the first week in December, the NHS would be full. Not just full in normal terms, but incapable of admitting other patients. When that happens, if that happens, then the consequences are, as the Prime Minister pointed out last night, in moral and in medical terms, impossible to accept. Because, again, what we would see would be people who had very serious conditions, not capable of being treated, people with COVID, who could be treated in hospital, not capable of being admitted. That would mean more pain and more death.
So worse than the first wave?
Yes, that is the real danger. Again, the projections that we've seen from a variety of different sources, it's not simply one group of scientists, but different groups of scientists, all say that without acting, we would see the number of people in hospital exceed that that we saw in the first wave during this month, around the 20th or so of November. And then, as I say, NHS capacity fully occupied.
Okay.
And as you will appreciate, many people are understandably concerned and have argued, is this focus on COVID somehow a means of neglecting, or does it result in a neglect of other conditions? Well, one thing is certain. If our hospitals are full, if there's no more NHS capacity, then that means that those people who suffer from heart attacks and strokes and who require cancer treatment won't get the treatment that they need. Okay. So tackling COVID is absolutely central to making sure.
I understand.
Absolutely central to making sure that we tackle our broader health problems.
I'm keen to talk about an exit strategy.
Yes.
Because we all know once you're in lockdown, it's very difficult to get out of lockdown. So whatever happens, will this national lockdown end on the 2nd of December, or will it be driven by what the data shows?
Well, we're going to review it on the 2nd of December, but we're always driven by what the data shows. Now, on the basis of...
so it could be extended? On
the basis of what we've been told, we believe that all of the measures that we're putting in place will reduce the R rate below 1. As you and our viewers know, that's the point at which you actually see a decline in the spread of the virus rather than its maintenance or increase.
So that is the key data you'll be looking at. And if the R hasn't been brought under 1 by the 2nd of December, could the lockdown be extended?
We're going to look at all of the data. We've got this 4-week period during which we're going to review progress. But, of course, we'll always be driven by the data. Now, it's our hope, on the basis of the analysis that we have, that we will have significantly reduced the reinfection rate. And again, one of the things that I know is very difficult, because none of these measures are easy, is that people will understandably say, well, this particular restriction, this individual restriction, is something that I find particularly difficult. Can we take it away? The difficulty is that if we chop away at all of the restrictions, we may end up in a position where we don't have a sufficiently strong team or bundle or raft of restrictions necessary in order to get R below 1.
So to be crystal clear then, what you seem to be saying is if you're hoping, of course, the data will show the infections are going down, that the R is going down. But if the data on the whole is not looking as you are hoping, then the national lockdown could be extended. We
will always take a decision in the national interest based on evidence, the best information we have.
Is that yes?
Yes.
So it could be extended?
Yes.
National?
Well, we want to be in a position where we can, and I believe that this is likely to be the case, have an approach where if we bring down the rate of infection sufficiently, we can reduce measures nationally and also reduce measures regionally, because the regional approach is one that, wherever possible, we want to take, because, again, we recognise that it may be the case in the future that having reduced R below 1, having reduced national restrictions, we may see a specific upsurge in specific areas which will require specific regional measures. OK.
Now, on Thursday, your colleague Robert Jenrick said this to Kay Bailey. I just want to show our viewers and yourself. He said this about a national lockdown. He said, if it succeeded, it is likely then needed to be repeated regularly. You can't have a stop-start country where businesses are closing, people are losing their jobs, and then they're having to restart again. So even if this lockdown is successful, you can't rule out further national lockdowns in the future.
Well, one thing we can definitively say is that unless we take action now, as we've discussed, the NHS is going to be overwhelmed in a way that none of us could countenance. So therefore, we have to take these steps. But no one in government relishes taking these steps. We believe that by doing this now, we will be in a stronger position later in December to have a stronger testing regime. We've significantly increased testing capacity. And we also believe that we will further have developed our approach towards therapeutics, and therefore we will be in a position better to manage this situation. But again, we'll always be guided by the evidence on what is right, and what recent weeks, recent months have shown is that this virus, as the Prime Minister said, is a terrible force of nature.
I think no one would disagree with that.
Yeah.
But at the same time, do acknowledge that the very fact that we're staring down the barrel of another national lockdown, that represents a failure of the government strategy so far, doesn't it?
No, I don't think so. I think what it represents is the power and the malignancy of the enemy that we face. That all governments, this government particularly, believe in liberty, do not want to restrict people's freedoms, but faced with the ferocity of this virus, this government, like other governments, have reluctantly but firmly taken the steps required in order to combat it. And one of the reasons for that is, as we discussed earlier, if we were to have a situation where we found our NHS overwhelmed, it would also have effects, inevitable effects, on our economy and on people's overall confidence in their ability to go about their daily lives. So this is a protective step that we need to take that nobody relishes, which the Prime Minister reflected on deeply. We all did, but we feel that there is no alternative.
One of the most depressing things about the situation, it feels to me, is that in the first wave, 40,000 people lost their lives.
Yes.
At a higher death toll, the highest death toll in Europe. And yet it's hard to escape the feeling that we're not learning the lessons of that first wave. One of the major lessons was that the quicker you act, the shorter the lockdown has to be. And yet on the 23rd of September, Sage said that we need a short 2-week national lockdown. You didn't take that advice. Now we're looking at a 4-week lockdown that could be extended. Why are we making the same mistakes in the second wave as we did in the first wave?
Well, again, I'd refer back to what the Chief Medical Officer said last night. There is no perfect
But they
time
said on the
to
21st
act.
of September that a circuit breaker should happen.
Well, there's a diversity of opinion, of course, but the view that we had from the Chief Medical Officer, the Deputy Chief Medical Officer, is that a regional approach was a way of balancing restriction of the virus and also the economic life of the nation.
The view of Sage, which they chair, on this 25th of September, advised a package of interventions, including a circuit breaker, banning all contact within the home with members of other households, the closure of all bars, restaurants and cafes. And I understand you're going back to the regional approach, but as we discussed, your own chief scientific advisor, Sir Patrick Vallon, said the 3-tier system on its own won't work.
Well, again, as I pointed out earlier, the 3-tier system, when you just have the base on its own...
Sage thought you should have acted quicker, didn't they? That's the fundamental point here.
Well, the key thing is the Chief Medical Officer made the point last night that there is no perfect time to act, and secondarily, the advice that we were receiving at the time was that it was perfectly reasonable to take a regional approach. And we weren't outliers in that regard. That was the position that the French government, that the German government, and that others were taking. We've taken the steps that we have now because we've recognised that the rate of increase of the virus, as I mentioned earlier and as you acknowledged, has been greater than was anticipated. And there are lessons that we've learned from the first lockdown, lessons that we've learned about how we treat people in hospital, which mean that people are less likely to die, lessons about testing, which meant that we've increased our testing capacity to nearly 500,000 and rising. And also one of the other lessons that we've learned from then is the vital importance of making sure that we protect the NHS and also do everything that we can at the appropriate moment to support the economy, which is also why the Chancellor of the Exchequer announced yesterday the extension of the furlough scheme.
One of the major lessons of the first lockdown, the major mistakes, was not protecting people in care homes, some of the most vulnerable people. And yet, once again, it feels like you're making the same mistakes. My colleague Ed Conway revealed this week that in Leeds, for example, COVID-19 is now higher in care homes than at the first peak of the virus there. And the government guidance still says that people who've tested positive can be discharged from hospitals into care homes.
No, well, I'd say several things about the care home sector. The first thing is that we are making sure that the spread of the virus in care homes, with the benefit of the analysis that we've done, has often been linked to people who've been working in more than one care home. And what we've done is we've put in place protocols, infection control protocols.
It's also people being discharged from hospitals into care homes, and the same thing is happening.
Let me make 3 points. The first is that, as we look back, the evidence suggests that the single greatest cause of the spread of the virus in care homes was from people moving between them. We have infection control protocols in order to prevent that. Secondly, we've provided hundreds of thousands of pounds to care homes in order to ensure that their staff can effectively isolate, and staff are being tested as well weekly in the care home sector. The third thing is that when it comes to anyone who's being discharged, we're making sure that anyone who is discharged from hospital into a care home is in a secure and isolated setting. And the Care Quality Commission is looking at the increasing capacity of those specific beds which ensure that anyone who is discharged is in a safe environment. Okay. So all of this is in the Winter Plan for Care that my colleague Helen Waitley has published, and it is a detailed plan in order to ensure that we mitigate and reduce the risk of infection.
OK. Now, you mentioned the economic support earlier.
Yes.
Will that economic support be extended to cover the entire period for which these restrictions last for?
Well, the economic support is going to extend for the period until December the 4th, but what we've always said is that we review the support that we are giving. The Chancellor has said that we are there to put our hands around individuals and the economy. Well, again, I don't want to anticipate the decisions that will be taken between now and December the 4th. As you quite rightly point out, with a virus this malignant and with its capacity to move so quickly, it would be foolish to predict with absolute certainty what will happen in 4 weeks' time when, over the course of the last 2 weeks, its rate, its infectiousness, its malignancy have grown. And so, therefore, of course, we'll review what requires to be done, but we have a clear plan over the course of the next 4 weeks to support the economy and to protect the NHS.
Why was it impossible to pay 80% of workers' wages in Greater Manchester when 2 weeks later you did it for the whole country?
Well, one of the things about that time is that we were seeking to negotiate with the Mayor of Manchester and others in order to ensure that we could move from Tier 2 to Tier 3. And the Mayor at the time and others were arguing that that Tier 2 was where they wanted to stay, even though the economic support they would have got...
They wanted
just 1 second, even though the economic
wages.
support they would have got would have been greater in Tier 3, and in Tier 3 they would have received both more economic support and also they would have done more to contribute to restricting the spread of the virus.
You didn't agree to 80% of wages?
We did agree to a generous economic package, which would have been
so my question is, why is
which would have been welcome had it been introduced earlier.
Why is it
the
unacceptable to pay 80% of workers' wages in Greater Manchester, but OK to pay the whole country 80% of wages now? Well,
there are two things. The first thing I would say is that the delay in Greater Manchester in moving towards Tier 3 has led to an increase in infections. The evidence shows that. And then the third thing is that we were talking to local leaders about what was required in circumstances where the restrictions were less than they will be now, because the restrictions that we're putting in place across the United Kingdom are stricter for understandable reasons and reasons that we've discussed than the restrictions that would have been in place in Greater Manchester at that time.
Just finally, there's an inquiry into who revealed details of the lockdown on Friday. Of course, we know who was in the meeting. It was you, the Chancellor, the Prime Minister and the Health Secretary. Should the person who leaked the details keep their job?
Well, there's a leak inquiry going on, and it's for the Prime Minister and the Cabinet Secretary to decide what action needs to be taken.
But what do you think?
I think it's for the Prime Minister and the Cabinet Secretary to decide. That investigation, I think, is very important because it's absolutely vital that when we have discussions, serious discussions, that it's possible for myself and for other ministers, and more critically for our advisors, to feel that they can share information in confidence. I think that's very important.